Welcome to the explainer. So you're on ADHD medication. But how do you know if it's actually working the way it should? It can feel like you're trying to hit a moving target. Well, today, we're going to break down exactly how to tell if you found that sweet spot or if it's time for a chat with your doctor. First things first, let's just bust a significant myth right out of the gate. Finding your perfect ADHD dose is not a one-and-done appointment. It's a process, a journey called titration. Even a dose that's been your rock for years might need a tune-up. Why? Well, life happens. Stress, big changes, even hormonal shifts can throw things off. So let's start with what's probably the most common situation, especially if you're just kicking off your treatment. Your GP is almost always going to start you on a very low dose, and that's a good thing. It's all about safety, seeing how your body reacts. But what that usually means is the first thing you'll probably notice are the signs that your dose is actually a bit too low. So how can you tell? Well, maybe your core symptoms like that restlessness or trouble focusing are still hanging around. Or maybe the only time you really notice the medication is on a day you forget to take it. You might find you're still procrastinating just as much, or your emotional reactions are still pretty intense. If this sounds familiar, don't get discouraged. It's actually a good sign. It means the meds are doing something, just not quite enough. It's not a failure, it's just step one. And here's a very concrete, measurable sign you can actually track yourself. Let's take short-acting dexamphetamine, for example. It should last about 3 to 4 hours. But if you're finding, consistently, that it's wearing off after just 2 hours, well, there you go. That's some solid data you can take straight to your GP as evidence that your dose is probably insufficient. So let's flip this around. What about the other side of the spectrum? What are the signs your dose is actually too high? Because the goal is always the lowest possible dose that still works effectively, and it can be surprisingly easy to sail right past that sweet spot if you aren't listening to what your body is telling you. This is probably one of the biggest, clearest red flags your body can wave. Do you feel kind of robotic, emotionally blunt? Maybe your family or friends have mentioned you seem a bit off, or that your sense of humor has gone missing. If you just feel flat, that is a significant sign that your dose is too high. So let's define that term, emotional blunting. What does it actually mean? Well, it's exactly what it sounds like. It's this feeling of being detached, less responsive emotionally, almost like your personality has been kind of turned down with a dimmer switch. Remember, your medication is supposed to help you manage your ADHD, not wipe out who you are. This is absolutely something you need to bring up with your GP. And it's not just about feeling emotionally flat either. There are other signs to watch for. Like, are you over-focusing on all the wrong things, getting stuck on a tiny detail instead of the big project? Or what about physical signs? Like feeling jittery, like you've had way too much coffee, or maybe you're clenching your jaw, or you've completely lost your appetite. These are all significant clues that it's time to talk about dialing that dose back down. Now here's a hard number, a very critical one to keep in mind: your heart rate. Now, a slight increase is pretty normal, but if your resting heart rate is consistently over 100 beats per minute, that is a clear clinical sign that something's not right. Don't wait for your next appointment if you see this. You need to give your GP a call. But what if you've been up and down the dosage ladder and nothing? You're just not getting the benefits, or if the side effects are awful no matter what? Well, it's time to consider a very important possibility. Maybe it's not the dose that's wrong, maybe it's the medication itself. See, it's absolutely vital to understand this. Here in Australia, the TGA-approved stimulants basically fall into two main families. On one hand, you've got the amphetamine-based meds, like Vyvanse and dexamphetamine. On the other, you have methylphenidate-based ones, like Ritalin and Concerta. They work on your brain in slightly different ways, and here's the kicker. Your brain might just have a strong preference. Having a bad response to one class tells you absolutely nothing about how you'll do on the other. So when should you think about a switch? Well, if you've gone through the whole titration process, tried a bunch of different doses, and you're just not seeing any real benefit, that's a big one. Or if side effects like anxiety or insomnia are sticking around no matter how low the dose is. And another key one is if you get this awful, unbearable mood crash when the medication wears off. These are all significant signs that it's time to talk about switching to a different class of medication. That was a lot of information, so let's pull it all together into a very practical, actionable game plan for what to do next. Remember that word we used earlier? Titration? That's the formal name for this whole process, and it's so important to know it's not just random guessing. It's a structured, careful process that you and your GP do together based on your feedback. Just knowing it's a methodical thing can make the whole journey feel way less daunting. So here it is, your 3-step action plan. Step 1, track your response. Just keep a simple daily log of the benefits, of the side effects, how long did it last. Step 2, identify the signs. Use everything we just talked about to put a name to what you're feeling. And step 3, schedule that review. Book an appointment to go over your notes with your GP. Walking in with this info makes for a much more productive conversation. And this is probably the most important thing I'll say today. Please, never adjust your dose on your own. This isn't something to experiment with. Dose adjustments need clinical guidance to be done safely and effectively. Always work with your doctor on this. And look, if there's just one thing you take away from all of this, let it be this. Needing to adjust your medication is a completely normal part of the process. It's not a failure at all, in fact, it's the exact opposite. It's a sign that you are being an active participant in your own treatment, fine-tuning things to get the best possible result for you. So I'll leave you with a question. Now that you can spot these signs, what are you going to discuss at your next GP review? You have the knowledge now to be a true partner in your own treatment. What are the specific things you can bring up that will get you one step closer to that perfect dose?